In this video, we're going to address thoracic extension and how gradually, over time, we can restore some of the natural curvature of our spine and improve the movement of our scapula and upper back. We will discuss how to loosen up some of the tight tissue of the anterior, pulling us forward into this rounded and kyphotic posture. And it also leads to our lack of overhead mobility, and it's going to increase our injury to anything in our shoulders. We'll also cover how we can strengthen the tissue of our upper back, helping our posture and pulling us into a better position. Today, to complete all this, we're going to need a lacrosse ball, a yoga block, and a foam roller. The first thing we want to do is we want to start by promoting blood flow and helping fluid dynamics in the tissue of our upper trap and our anterior delt. The more we can help promote blood flow and again hydrate the tissue, the better it's going to stretch and activate, so we can be more effective in the rest of this protocol. Let's first start by laying face down on the ground, placing a lacrosse ball under our anterior delt, where your pec and shoulder insert. While shifting our weight to the side of the lacrosse ball and placing that hand behind our back, we want to search for sensitive tissue that needs some attention. When you find a spot that's painful, take deep breaths and move your elbow up and down like a chicken wing. Another effective method is making small circles while on the ball. We want to perform this for about 60 seconds per side. Make sure you keep your shoulder on the ball and maintain constant pressure. Tight tissue is like a dried sponge. It's not very pliable and can be easily strained or torn. By using the lacrosse ball, we can help make the tissue healthier and improve fluid, getting in and out of the area, and make us more effective at the stretching and activation portion of our future workouts. Once we complete this step, let's move on to our upper trap. While standing next to the edge of a wall or a doorway, about a foot away, place a yoga block lengthwise against the wall at about chest height. At the edge of the yoga block, I want you to put a lacrosse ball. From here, you're going to go into a hip hinge and apply pressure vertically, leaning into the wall, making sure your trap is making contact with the lacrosse ball. Maintain adequate pressure with you against the ball to make sure it doesn't fall. From here, with your neck neutral, lift your arm behind you going into shoulder extension and searching for tender tissue of your trap. This area can create a sensation of pins and needles down your arm because of nerve bundles in that area that are sometimes blocked. Perform a set of 10 reps per side, lifting your arm as high as you possibly can. When we sit in bad positions at the office or from being stressed, we tend to shrug up our shoulders and excessively sit in scapula elevation. Loosening this tissue is key for neck and upper back health. While performing this, if you find a spot that's extremely tender, you don't need to move, you could just take deep breaths, and you can work on just rotating your neck at the same time, trying to apply pressure there. Next, let's focus on stretching the tissue of our pec that's pulling us forward into this rounded kyphotic position. Walk up to the corner of a wall or doorway, placing one hand at about head height. From here, take a step forward with the leg further away from the wall. While having a slight bend in your elbow, rotate away until you feel a stretch in your pec and shoulder. Hold this position, taking deep breaths for 30 seconds per side. Rounded posture and wearing backpacks in our daily routine make the tissue of our pec and anterior delt extremely tight, which then pulls on our upper back, weakening that tissue and creating bad posture. Relieving this tight tissue is key to improving thoracic extension and improving our general posture over time. Be slow while stretching this tissue and don't overdo it. The tissue is tight and it's going to take time for it to lengthen out. We don't want to strain anything in the process. Next, let's work on thoracic extension with a foam roller. While laying on the ground face up, place a foam roller on your upper back. Start by placing your hands on the top of your head. Then, take your pelvis and go into a posterior tilt, focusing on pressing your lower back against the ground. You should feel your core start to engage. Now, while maintaining this pelvic position, take a deep breath in and then breathe out all the air in your belly while you try to conform your upper back over the foam roller. Again, not losing that lower body pelvic tilt. While leaning back over the foam roller, take 3 huge breaths in and out, taking about 6 to 8 seconds per repetition before resting and performing another rep. Slide the foam roller down your back a few inches and perform this again. Perform this for a total of 10 repetitions. As we perform this, we need to realize that if we've had bad posture for a long duration of time, and if we've been sitting in bad positions for 10, 20, or 30 years, it's going to take time to loosen up the tissue and get our spine back into its neutral position. Be slow and patient with this process. If you're someone who has scoliosis or you've had major spinal surgery in the past and you feel any pain or discomfort, please refrain from doing this and see a professional to get a further opinion. When we're finished here, let's work on the ability to go in more thoracic extension, but now with our hands overhead while working on a prayer pose. From a kneeling position, with our hands on a foam roller, shift your weight back onto your heels, letting your torso fall towards the ground. Take deep breaths and hold this position with locked out arms overhead for 30 seconds. Make sure to maintain a posterior pelvic tilt and not allow your lower back to arch and compensate for the stretch on your upper back. By performing this protocol daily, we can loosen the tight tissue of our anterior and slowly improve our posture and get the ability to go into thoracic extension, which is just going to make it a lot easier to get our arms overhead, mitigating the potential of us going into lumbar extension, trying to arch our back, and then putting ourselves in jeopardy of injury there. By performing this protocol daily, we can loosen the tight tissue of our anterior and slowly improve our posture and our ability to get into thoracic extension, leading to it being easier to get our arms overhead and lowering our risk of injury to things like our lower back, because we're not trying to compensate elsewhere. This is going to be a very slow process. So my advice to you, don't get disheartened. Continue to do the little things every day to loosen up the tight tissue of your anterior while strengthening tissue that's going to help you be in better positions. And realize, if you've had bad posture for a long time, it's probably going to take a while to be fixing these things. But it's worth fixing, because when you get older, you're going to be feeling better and moving better, and that's more important. Your future self is going to thank you. So please, continue to take the time and do these things daily, and I look forward to seeing your results in the future when you tell me all about them. Have a great day. Keep it up.